So my name is Katie Pourier. I'm a registered psychologist here in Edmonton, Alberta. And 2015 or so, saw clients during my master's degree at the U of A, and have been working in the area of eating disorders and in the area of trauma. I spent the first few years as a provisional psychologist at the Sexual Assault Center of Edmonton for 2 years. And then after my first mat leave, came into private practice, still in that area of sexual trauma, eating disorders. And then after my second mat leave, came back and worked at the Pine Integrated Health Center, which is a focus on perinatal health and fashion as well. So those are my main areas of focus here in Edmonton. Absolutely. Both short and long term, just kind of partially depending on if people reach out. And I will kind of mention, maybe even just as I answer these questions, that I'll identify that the majority of the clients that I see are they identify as cisgendered women. So obviously, in terms of my scope of practice and the types of clients I have and the experiences that I would be hearing about in the therapy space will be different than maybe someone who works with different areas of the population. But definitely with regards to care that has not been as ideal and as compassionate as we'd hope in the area of after sexual assault experiences happening, in terms of how doctors or evidence is gathered after sexual assault. There's been experiences from clients that have not been treated essentially the way that we would expect people to be treated after something like that happens. I've had clients talk about exams and everything like that that felt very traumatic and that did not contain enough consent and enough discussion and enough compassion for them to really feel safe with these professionals who held inevitably difficult thing to process and a difficult thing to kind of work through in therapy. In the area of course, eating disorders, which I know we're going to talk more about later, definitely stigmatization and bias in terms of what an eating disorder looks like. There is no amount of blood work, there is no body, there is no one thing that would tell you that someone has an eating disorder, and there is no such thing as sick enough. If I always say, and I think I found this as a quote online somewhere, if you're sick of living the way you're living, then you're sick enough. And so doctors often, lots of stories from a ton of the clients that I see, either assuming you're not sick enough, you look fine, your blood work is fine, and just missing the mark on making appropriate referrals and essentially just holding space for the fact that people are saying something's wrong. They're asking you a question as the person in power. And this is often with the case with like GPs, let's say, that these stories of either being weighed and not given the option to weigh blindly, and that can be very triggering when you're struggling with food and body. So definitely things like that are big issues that we see in the medical community in terms of how we treat people or even screen for those types of difficulties. Yeah, I think in terms of the work that I would do, I think the big thing is validating that actually that wasn't okay. I think, one of the things I made notes on here today is that we often, and I would say especially as women, and that can be women, essentially people who identify as women, are taught, right, that this is kind of just how it is, right? Around pregnancy, these are the exams that you have to go through. Around eating disorders, this is just how it is. If they're going to ask you this, or if they're going to say you're fine, then you think you're fine, and it must all be in your head. The reality is, if something doesn't sit well with you, you are the expert of your lived experiences. You are the expert of your boundaries. You know best. And if you think something's up, if you're not okay with something, if you have questions, it's important for us to make sure that these professionals find different ways to make space for all of that for clients. So I think in our work, it's providing that space to validate, hey, it sounds like this wasn't okay for you. It sounds like what you're telling me, that it's had a lasting impact on you. So how can we unpack that? So part of that can be looking and some psychoeducation about the roots of fat phobia and stigmatization and the fat phobia that we see inherent in the medical community. That the medical profession is inherently full of this idea of prescriptive weight loss, that we need to get people to lose weight, that solves the problem. And to kind of allow there to be space for clients to explore other possibilities, that that's not necessary to live a full and rich and meaningful life. And also for people who've had, for instance, experiences with essentially sexual trauma in the context of medical visits, helping them navigate that. One of my clients recently, and she did give me permission to share some of the sentiment here, of course anonymously, but said, any other circumstance where a stranger or someone you didn't know doing a pelvic exam, right, an internal exam, anyone else doing that to your body would be considered a violation, right? And I think we inherently just believe, well, this is just what has to happen. It had to happen that way, or I just had to put up with it. And often that mentality could have gotten you through, fair enough. And that can still cause trauma, right? And so, and obviously we're going to be talking later about maybe strategies for professionals to ensure that they're providing that kind of holistic care. That there's obviously privilege with, first of all, being able to access a lot of these different services. And there's privilege to be able to access the support to help you with the aftermath. That's not accessible to everybody, which is something, of course, that we want to see more change in. And during this time, I think of COVID, a lot of people are trying to make something like therapy, if that's, you know, the type of support people want, we're trying to make it more accessible. But I just want to acknowledge first that not everybody has the privilege to access those services, to actually work through these traumas, and that their struggles, their feelings are valid. And even though the types of professions that are out there that might kind of be full of, got to work fast, we got to get right to it, you know, a typical doctor's visit, there's not a lot of warm up, there's not a lot of maybe talk about consent and everything else. It's just like, let's get to it. And you're allowed to feel off about that. You're allowed to expect, you deserve to expect better care, right? Compassionate, respectful care that treats you like a human being and is sensitive to the fact that you might have a history as you sit on that exam table, right? Or as you go for your pelvic exam during pregnancy or even after pregnancy, that is going to be wrapped up in a lot of different history. So I think even allowing people to develop that compassionate inner voice to say, this wasn't okay, right? And even if we can kind of hold ourselves, I'm like hugging myself right now, even if we can hold ourselves kindly in those spaces, because I think part of it is that we aren't going to necessarily move through it if we also don't allow ourselves to acknowledge that this wasn't okay, that this caused pain, that this caused harm. So I think helping people develop those skills, and impact. Yeah, and I think sometimes too, depending on if it's accessible to people, some people find it empowering and healing to, you know, make sure that the next practitioner they go see, if they're about to go see a massage therapist, if they're going to go see a physio, if they're going back to a different doctor or even the same doctor, to slip a note to be put on their file, to call the office ahead of time to say, I do not want to be weighed, or I don't want to be weighed and see the number. I want to be weighed blindly. I want everyone needing to know that, or I have a trauma background. I need you to be aware of that during my massage, right? So finding a way, if it feels accessible, not everyone is in a place where that's something they're comfortable with. Could you pass a note to your doctor in person? Could you send it over email, over the phone? When you call the admin, could you make that a note on file to essentially allow the healing for the next person you encounter, that they know what to expect? And sometimes saying it verbally is not accessible. That's not a place that you're ready to discuss it verbally, but just so that part of your team will know what's going on. First of all, I want to acknowledge that I'm aware of a lot of really awesome trauma-informed physios, massage therapists, doulas in the community that we're in here in Edmonton. So first of all, I want to say like rah rah. If ever my clients identify people in the community that they've encountered who are providing just like treatment that I am like, wow, like trauma-informed, like yes, it's exciting. So I first want to acknowledge that there's a lot of really focusing on creating safe spaces for everyone to come get those services. And I think if it's possible, and I know that this is an idealistic idea, but we like for some kind of screening to be available. If that's either something you do online with a practitioner before you go for a first appointment, could we be screening a little bit more for trauma? One of the things a few colleagues and I are working on is trying to connect with doctors in our community to offer some education about how they could actually quickly but effectively screen for disordered eating and eating disorders, so that they aren't kind of bumping up against this piece where they don't know what to do. Because often these professionals are either referring to places with huge wait lists, which is essentially useless to the person needing support now to navigate those things. And so we want to help them essentially work more effectively, competently, and compassionately, right? And it doesn't have to be a very drawn out thing to add to your rubric of intake. But even if we just have a note on an intake form to check that out, right? For eating disorders, disorder eating, and a trauma history. Obviously, someone can choose to either put that in or not. That's their choice. But even just to get people thinking, oh, that's allowed here, right? Because I think our minds really open up when it's like, even some of the work that I've been doing over the past, being an anti-racist provider, and this piece of having any racial trauma being inquired about on an intake form, right? And it can help people see like, oh, they're actually naming it as this happens, right? This is possible, that this is an expect. And I think if we put it on something like that, it allows people the space to say, maybe I could make note of that here, right? And that can create some safety for people before they even come through the door. Um, and learn about those basic therapy skills. How can we validate someone, right? It's not about saying the perfect thing, but it's about connecting, right? As Brene Brown says, rarely does a response make anything better. What makes things better is connection. And people just want to be seen. They want to be seen as humans with complex baggage, because we none of us make it through this life unscathed, and we just want to be seen for that when we're in an appointment. And there's certain professions where it can feel less or more safe to kind of dig down deep into those things, but regardless, there are some basic validation skills and ways that we can help patients all feel seen and understood, even if we don't have the answers to their inquiry, even if we don't know what referral to use for them. The idea of, I will find out, right? I'm not going to leave you stranded. I don't know the answer, because it's very vulnerable as providers. I love not knowing, frankly, but not every provider is trained from the perspective of it's okay not to know, right? A lot of people are trained, you got to know all the answers, you have to have an answer right now. And that's just simply not the case. And so even to admit, I don't know, and I'm going to find out, right? And if that's available. And that's why some of us are trying to kind of see if we can get through the doors with these doctors to essentially like show them these are more rapid referrals that are available. This is the kind of way we'd love to see you refer, because then that ensures people actually get through the door and get the support that they need after they leave your office. And I think too, in terms of eating disorders and disordered eating and just the complexities of food and body, to offer people, all people, the opportunity to weigh blind. There are so many different ways during pregnancy as well that we can tell how baby is doing, amniotic fluid. We can do a lot of other things to see how things are going besides weighing people during pregnancy, for instance. And weight, I mean, that's a whole, episode in and of itself to talk about, why we record weight. But essentially to even put it on the table to people that like, do you want to weigh blind? do you want to be weighed? And I know that that's not something that is going to change overnight. That's a very deep rooted, natural step that they take through all these kind of physical exams and everything like that. But we'd love to see that as a shift, even the option like, okay, we're going to take your weight and height. And would you prefer to like be weighed blind, or do you want to be weighed today? Right. And have that be a discussion that's even offered to you. And finally, too, collaboration. I know with the area of eating disorders and disordered eating, I work very closely with some dietitians in our community, and a lot of times in terms of helping people through the recovery process, there's this triad of ideally doctor, psych, and dietitian. And we are sometimes collaborating, and that might not always be accessible for every single client, but within the professional, scope of what you're able to offer, that could be very helpful for people to know that they are being supported by all these different professionals who might be able to keep in touch, right?
Awesome. I love the idea of having that as like a casual question. Do you want to be weighed, or do you want it to be show you like something just so simple and casual so it doesn't have to be a big deal? I love that.
Mm-hmm.
You
Hold
already
so much power, right? They hold so much power that we tend to just do, especially in a doctor's office. There is this power differential that exists in the therapy space. But and as a feminist therapist, I'm naming it, and I'm saying, hey, I recognize that even though I would like us to be on equal playing fields in the sense of human to human, in the end, that's what we are. But I know as a white cisgendered heterosexual woman, insert all other privileges, that my worldview and everything will be different, but we are more concentrated as psychs to kind of level that playing field of that power differential. But sometimes in the medical community, it's incredibly difficult to feel at the same eye level as your doctor, right? It's kind of like, yes, okay, whatever you say, sure, okay, I'm out. And that definitely is something that we want to see shift. So, I mean, yeah, like as a clinician myself, it's always going to be important for me to be on top of like my own stuff. So to make sure that I'm having my own therapy space for myself. We all have internalized biases. As again, as a white human, white cisgendered heterosexual woman, I benefit from the systems of oppression that aim to oppress other people, like white supremacy, racism, right? All of those things. So that is my work to do. And it's my job to be uncomfortable and to do that unlearning and relearning, to make sure that I'm providing anti-racist care, inclusive care, and like creating that safe space. Continued education on the areas. I know Callie, who you spoke to a few weeks back, right? All these pieces around gender and all of these pieces to make sure that my language, I'm using appropriate language for where people would be. My biggest thing as a practitioner, though, in terms of it adjust or acknowledging my biases and stigma, are also to approach everything with curiosity. Like I said earlier, clients are the experts of their lived experiences. So I don't care about being right. I care about getting it right for my clients. So if I slipped and said one pronoun and they go by a different pronoun, I make sure that I catch myself and come back and apologize and keep going. Or I check and I ask questions, or I wait and I listen and I see how they talk about their worldview, right? So I think that piece about addressing bias and stigmatization that we inevitably all have as humans is to be curious, make sure you're doing your work, and essentially, yeah, let the client tell you what is true for them, and to let that lead the therapy work.